So today's episode on Let's Talk Wellness Now, we are diving into the world of mold. Many of you have heard me speak about mold in the past. It has been a pillar in my own recovery of MS. And today I want you to meet a dear friend of mine. Her name is Andrea, and she is part of Respirari Labs, but she also has been a consultant in the past for people struggling with mycotoxin illness. Mycotoxin illness is a tragedy as far as I'm concerned because it is so underdiagnosed and misdiagnosed because it's just not well known by a lot of practitioners, certainly in the traditional world, but in the alternative world, it is a newer disorder that people are learning about and not everyone is extremely knowledgeable about. And I think it really needs to be the forefront of a lot of these undiagnosed or misdiagnosed cases. We see a lot of mycotoxin illness at the root cause of neurological conditions, ALS, MS, Parkinson's, dementia, Alzheimer's disease. And if not treated and addressed, these disorders will not improve and sometimes end very tragically for us. So I want to introduce you guys to my dear friend Andrea today. And she will be a wealth of knowledge for you and hopefully put some of your fears at risk about remediation of your home, but also probably bring up some things that you never knew about mycotoxin illness.
Thank you for those very kind words. It's wild that as I hear stories like yours and mine so often, it's wild how similar they are. And so these topics are so important to bring awareness to, and I appreciate the work that you're doing to do that. So thank you for being here and for letting me be here with you.
Oh, you are so welcome. So tell us your story. How did this happen to you?
You got it. So it's all very ironic. In 2017, we were living in a rental home in Robbinsdale, and we were renting as we were kind of getting out of debt. I was a pre-med student and starting up my family with my husband, who I met later in life. And our 2-year-old daughter contracted lead poisoning from our rental home. She she was chewing on a windowsill, and I thought, oh my gosh, I bet there's lead paint on that windowsill. We tested the windowsill. Sure enough, there was lead paint. Tested my little girl, and she had lead poisoning. We weren't financially ready to buy a house, but we qualified for just enough. My mom is incredibly smart. She's been a realtor almost 50 years, and she helped us, find a home. And so we found a home that we liked, and a modest home, but clean and built in the 90s, so no lead paint. And we had, a general inspection, and it didn't really raise any red flags, and we moved in. So we moved into the home end of October of 2017. Almost 2 months to the date later, our 5-year-old dog died. She developed a very sudden neurological disorder. It was very rapid, and it was at the time we didn't, put pieces together. But it's interesting that I somehow knew it was environmental. Like I can't, but I didn't put the pieces together. Anyways, my upon moving in, my health started to decline. But as it is for so many women, I didn't connect the dots because I had just had my third child. He was 9 months, and I thought, well, maybe this is postpartum. I was experiencing migraines, and that wasn't typical for me without being pregnant. And my ears started to ring. I started to experience anxiety that was not typical for me. And it just kind of snowballed from there. And eventually I went into my doctor and I said, I'm having anxiety that's not typical for me. And for me to go see a doctor over that, if you knew me, you would have to know it was pretty extreme. It was to the point where I couldn't go to the grocery store. And so it just kind of got worse from there. And then it progressed into migraines that would last months at a time. And my worst migraine lasted 3 months, day and night. I mean, 3 consecutive months, day and night. And it was so severe that at the time, my husband had to hide the guns in the house because I was suffering, and I was begging him to help me die. I mean, if you've ever had a migraine, maybe you can understand that.
Yes.
But on top of these migraines that I couldn't control, I was confused. And I couldn't remember my children's names. At one point, I looked at my oldest son and thought he was my baby brother. There was one day my husband came home and I wanted to say to him, "Did you see the email from Grace's preschool teacher?" And I couldn't find my words. And finally, I just sat there and started crying. And my sweet, loving, patient husband said, "Are you asking if I saw the email from Miss Annette?" And I said, "Yes, yes, that's it." So we made so many doctor visits and in the ER, and we kept saying to these doctors, I've got this migraine, but I'm confused. And they would do CT scans. Well, then it was, you need psychiatric help. You need a psychiatric evaluation. And my doctors were very, very frustrated with me. In 2000, end of 2019, 2020, I believe I was diagnosed with Lyme disease, Bartonella, Babesia. And that made sense to me. They think that I've had Lyme disease since I was a teenager. And that makes sense. I live in Minnesota and I love to fish and be in the woods and forage mushrooms. So that made sense. We treated Lyme disease out of pocket for about a year. And by that time, I hadn't worked in 2 years. I was mostly bedbound. I had inflammation throughout my body. I was dealing with just a myriad of very strange, debilitating health effects.
Mhm.
And we've never been a one income family. So we were really struggling. My husband was a chef at the time. It was during the lockdowns. It was during COVID. And so his pay was cut. He was working all the time. And then we had like these crazy out of pocket medical expenses. I said to my doctor at one point, because I wasn't getting better, I said, "I think I might be living in mold. And I've been reading about the Lyme and mold connection." And he was just like, "Oh, I'm not really worried about that." The next time I met with him, I said, "Doc, I know I'm living in mold. I can see a little bit of it in my basement." And he says, "I'm not worried about it. We'll deal with it later." Well, later never came because we ran out of money. So by the time we figured out that the culprit was environmental, we were tapped out and we didn't have anywhere to go. And so we moved out to a tent in our backyard with our two small children, our two dogs. And by this point, I was ready to take my life. I listened to your podcast interview and it was so wonderful. And I love the fact that you mentioned that mycotoxins can cross the blood-brain barrier, and this can cause inflammation in the brain. And that's important to know because it's important for healthcare providers, for social workers, for professionals, and for folks to
Mhm.
know that mold exposure can manifest as mental health disorders. It can look like anxiety, depression, pans and pandas in kids, personality changes, dementia, all of those things. And so besides the fact that I was suffering, I was just very unwell with this swelling in my brain. And so I rewrote my life insurance policy and I was very aware of when it would pay out. I tripled the coverage and then I planned to take myself out of this world. And my thinking is I can't live like this. I'm suffering. But also I knew my home was toxic. I could feel it. And, my husband, who's got a healthy immune system, didn't. And I knew I needed to get my kids out of this home. And so we lived in the tent and I had these plans in mind. Nobody knew. And so I said, well, if I am going to leave my children motherless, I'm going to fight like heck. So I started reading because my education was in the sciences. I dove into everything I could. I read textbooks on mold remediation, indoor air quality, environmental testing. I reached out to professionals in the industry. Michael Pinto, he's a wonderful professional and an educator. He sent me a free textbook. I read it cover to cover. I read everything I could on mold toxicity. I read Dr. Neil Nathan's book, Toxic, all of his suggested reads. And 2 weeks into reading, I was talking over the heads of the professionals that I had hired, and that was really alarming to me.
Mhm.
And they didn't know what mycotoxins were, and I thought, wow, this is really unregulated. So I became the professional that we so desperately needed. I recovered my health greatly. Fresh air and good food and supporting my detox pathways. And we did remediate our house several times. By the way, the small bit of visible mold in our basement was extensive. It was throughout our entire basement, everywhere, and it was very, very hidden. We just had no idea. So by the time I recovered, I found a local company here in Minnesota, and I reached out to the owner and I said, I want to work for you. And he says, well, I don't know what you would do. You're hypersensitive. And, we do inspections and mold remediation, and I don't know what I would do with you. So I chased him down for 3 months, and we were about to lose the house. And I knew that this is where God was leading me to work. This is, all this education I had. This was a seed that was instilled in my heart to work in this industry in some capacity, but how? So finally, after 3 months, I said to him, I said, listen, if you don't hire me, I'm going to show up at your doorstep. So he did. He finally hired me. And the first day of work was kind of funny. He says, well, there's a desk. And he says, I have no idea what you're going to do for me. And so I worked for that gentleman for 3 years, and I created my role in his company, which was really exciting because I could use my own strengths, my passion. And so what I did for him was I remember one day he says, I need to make a business card for you. What's your title? And I'm like, how about, client advocate and director of education. So what I did for him was I worked to build relationships with doctors like yourself and indoor environmentalists. And that's really where my passion is, because if we are going to make progress in these environmentally triggered illnesses, we have to have providers like yourself working with indoor environmentalists. And you would be, and maybe you wouldn't be, surprised to know that everybody's really compartmentalized. And it's important that doctors like yourself, you stay in your lane. You know all about the body and how to diagnose the body. And indoor environmentalists, they need to stay in their lane. They need to not be giving health advice or saying mycotoxins. What are those? Those aren't real. It's in your head. And so, but it is important to work together, because one thing that I want to impart on anybody that's dealing with these things is that navigating mold toxicity is difficult, and it can be financially exhaustive. It requires a multifaceted approach. You have to diagnose your home. Not easy. You have to heal your home. You have to diagnose your body, heal your body. And like so many of us know, it's not covered by homeowners insurance. It's not covered by health insurance. So you have to go at it very thoughtfully with being very cognizant of your resources.
Mhm.
And that's hard to do when your brain is swollen and people are telling you like you're nuts, or your spouse is like, well, I'm fine. I'm fine. I don't, if there's a problem, you leave. And my husband said that to me at one point. He's still alive, by the way.
And you're still married to him.
Yeah, oh it's mold and marriage is a topic I like to talk
Oh,
about a lot, because it is, and I want to make this really clear. It is par for course that not everybody is sick in the home. And
yeah.
what we noticed is once we moved out, we saw things fall away. We saw behaviors from our children fall away. We saw all three of my kids, I have 3 kids, all 3 of them had eczema. Never
Mhm.
had that issue again. So it affects people very differently, and that's par for course, because these mycotoxins, they get into our body, into our bloodstream. They're very small, and so they cause systematic damage. You've got genetic predispositions, gender plays a role, past exposure. So it's very typical to see family members react differently. My husband has an immune system like a wildebeest. He is he is wonderfully he's a good detoxer. But after we moved out, he noticed a difference. But if you don't have your spouse on board, it's going to be very difficult because it's expensive. Things have to be done right. But
Yeah, we've
um,
seen that as well. Like so many of our clients end up, their marriages don't survive. It's too hard. Sometimes there's divorces that become very ugly and there's, fighting over the children and one thinks the other one is crazy and it's devastating. It's devastating our families. It's devastating marriages. It devastates the finances, like you've said. I mean, I've seen people mortgage their homes 2, 3 times over to try to save the home because they don't want to leave the home and leave it to someone else who will get sick, or they can't afford to leave, or they've invested so much in a remediation, it's impossible now to leave because there's so much invested, they'll never get their money out of it. There's so many stories. And I love what you're talking about, staying in the lane too, because we get asked all the time, how do I clean up my house? And yes, we can help tell you where to go and what to do and how to start a process, but we don't know we haven't never seen your house. As the healthcare practitioner, I don't know your house. I don't know what it's like. I don't know what you have growing in there. We can tell you things, but sometimes the things that we tell you might make your home sicker instead of better. And it is very hard to stay in that lane. You want to help everyone, you want to give them a place to start, but I agree so much. Having a good building biologist or environmental specialist come in and really evaluate the airflow and the humidity and look at the house and see what's going on. It's going to save you a ton of money doing that versus us just telling you to start doing this and this and this.
I- you touched on some good points that I want to bring up because a lot of people say, well, Andy, why don't you guys just move? Well, first of all, it's not that simple. We've
Right.
lost equity, and I would never leave my home to somebody else. But also, besides losing equity in our home, we're in debt. I mean,
Yeah.
when I finally went back to work after 2 years and I was making minimum wage, but
Mhm.
so grateful for that income. My wages were garnished for unpaid medical bills, and which was devastating. But also, my home is cleaner than most people's, and
Mhm.
and that's we've had friends that were very well meaning, like come stay here, and I'm like, my house is worse, and that's
Yeah.
something that people need to understand is there is no perfect house.
Yep.
And this is not a one size fits all. So, there's people with like wooden foundations, as wild as that sounds. No, thank you.
Yep.
So there are situations where it's like it's not worth it. But there is no perfect house. And once you're hypersensitive, you're hypersensitive. And
Yep.
so I'm a fan of making your home where you're going to choose for it to be, and then allocating your resources to making that home the best that it can be. There's a lot of things you can do to improve your air quality. You can invest in a good ventilation system. That's important. Putting up a gutter system, getting, good air purification technology, being cognizant of what products you're bringing into your home. And that's really important. And, I want to talk about testing the home because this is important, and it's often a topic where folks spend really a lot of money that could be better invested. So,
Very confusing to people.
yes. So when people ask me, I love to read, and when I was in school, I loved microbiology, and so I love to read about environmental testing. That's what I do on the weekends. I'm a real hoot. But people always ask me, Andy, what's the best test? And I'm like, well, I need to test my home. What test should I do? And I'm like, well, wait a minute. And I ask a lot of questions first. And the reason is that there is no one perfect test. And each test is going to tell you something different. And also, I'm a fan of very objective based testing. And let me explain. So, say you said, Andy, I need to test my home. What test should I do? I'd say, well, Deb, do you own or do you rent your home? And That's a big question, because if you rent your home, your objective in testing it might be really different than if you own your home. So if you own your home, your objective should be, hopefully, to identify sources of moisture, to identify building defects, and to determine exactly what building material is affected by mold, right? It's like if you had cancer in your body, you need to know where it is to take it out. Now, if you're renting your home, the objective might be, well, I know there's mold here. I know it's affecting my health. I want to get out of my lease. Or maybe it's for legal reasons. Some renters just want to know, is my environment a factor? So that's the first question I ask. But when you own your home and you're starting the process of diagnosing a home, what you don't want to do is simply just acquire data points and data points that maybe you can't fully understand. And because that can be dangerous. I've seen people make very big and expensive decisions based on one test. I mean, leave houses behind and everything they own. So you want to start holistic. A good mold inspector is somebody that knows mold and mold testing methodologies, knows the strengths and limitations of each, and then also understands the building sciences and the building construction. So they should know changing building codes. They should know the anatomy of the home, right? Very similar to expecting a medical doctor to knowing the anatomy of the body. So that you want to start holistically looking at the home, looking at ventilation rates, which is CO2 levels, and using thermal imaging and moisture meters, and doing a very thorough visual inspection. People, people always say, "Oh, air testing, it's terrible. It's terrible." Okay, well, what kind of air testing are we talking about? Because there's a lot of them. We can test air for VOCs and mycotoxins and spores, but typically when people are gruffing about air testing, they're talking about spore trap air sampling. And yes, it has a ton of limitations, a ton of them, and it should never be done without the understanding of these limitations. So for those who don't know what I'm talking about, spore trap air sampling is done with like a pump at a certain volume, and then they take the samples and they're typically evaluated through microscopy, and then they can identify the genera of molds in the air. And that can be useful because a spore of Stachybotrys is going to be representative of long-term water damage, but it's inexpensive. And so typically the initial evaluation of a home will involve spore trap air sampling, and it's a piece to the puzzle. However, there is a time and a place for more expensive or focused tests. And so about a year ago, my health started to decline again, and was in the industry now for 3 years. I had access to more tools and resources than most people. And I was playing that game of, is it perimenopause? Is it Lyme? Am I doing too much? So I traveled, I went away, and because I wanted to experiment, and I came home, and I was certain that I was being affected in my bedroom. I knew it. And so we started sleeping in a different bedroom, and it was different. And then we started sleeping in the camper, and I knew it. I said, there's something going on in this bedroom. So I had multiple inspectors come out. They used all the tools that I mentioned. They had all the knowledge that I mentioned. They did spore trap air sampling, came back clean. They did wall cavity sampling, came back clean. We did a dust test that looks at mycotoxins, came back clean. There was no issue, but I was really persistent. I said, I know that there's something going on in here. So then we ran what's called an AMEA, AMEA, stands for Airborne Mycotoxin Environmental Analysis by Respirari. And it came back off the charts with mycotoxins. Came back really high with aflatoxins, triglycines, and ochratoxin A. And man, I cried. And by the way, the previous homeowner of our home died of liver and lung cancer at 56. She was diagnosed in January. She was dead by June, and then we bought the house in October. And for anybody listening that doesn't know, aflatoxin is a mycotoxin. It is one of the most known and documented carcinogens known to man, and it is correlated with liver and lung cancer, and actually the precise cancers that the previous homeowner died of. So getting that data point was very validating, but we didn't know where the mold was. And so we took out a second mortgage, just like you just talked about, with an interest rate that made me throw up. And we did exploratory remediation. So we re-sided the home. We found mold behind the siding near my bedroom, thanks to a woodpecker. Once the siding was off, we discovered the windows weren't flashed. Those were moldy. We found a very saturated moldy subfloor in our master bathroom. We demoed our master bathroom and our bedroom and did the siding. It was very expensive, but we found the mold. I'm telling this story because it's important to understand the limitations of a non-invasive inspection. There are going to be situations where you cannot know there's mold there until you take it apart. Yep. So I was grateful for this EMEA because it was the only test. And remember, I ran a number of tests in that room. Yeah. It was the only one that confirmed what I was feeling. And so, by the way, that test is through Respirari Labs. And I chased them for a year and begged them to hire me. And they just did. So thank you. I'm a proud new addition to Respirari Labs, and I'm very happy to be there because this test, the technology is new and it's very exciting, but it's very sensitive. But it's important for folks to know that there are limitations to non-invasive inspections, and if you have somebody that is in that situation where they feel it, I trust your gut. I've never been wrong. Yep. We've always found it. And if you're feeling stuck, what I tell folks to do is, I'm in Minnesota, so our time is limited on to do this, but in the summer, put up a tent, get out of your home as long as you can. When you travel away from your home, the minute you walk in the door, and I still do this, walk around your entire house immediately, use your nose and smell the house. Because we become nose blind. It's crazy. We become nose blind within minutes, and my husband calls me the nose. I've got the sniffer. But when you take yourself out of an environment, that's how I figured it out the first time. I went to see my best friend, and we were struggling with my health, and we knew about mold, but we didn't think it was our issue quite yet. And I traveled away. I came home after a week, and after 10 minutes of being home, I said to my husband, I said, it's the house, it's mold. So just a tip for anybody that is feeling stuck.
And I would say too, like every house has a smell to it, right? Every house has its odor, its stuff. But you're right, when you're sensitive, you know it's mold, and it doesn't always smell musty. That's the other thing. It doesn't always smell musty. It doesn't smell moldy. It doesn't smell like old grandma's basement or old grandma's house. It can smell like so many different things, but you are so right. I remember after I had my sinus surgery, and had the fungal ball removed. And he said to me, you're going to be really sensitive. So if you walk in someplace and you smell something, get out right away, go flush your nose. And we were on our way back, driving back from Atlanta, and we stopped at a gas station, get gas, have a potty break. And I took 2 steps in this building, and I turned around and walked out. I said to my husband, where is my nasal spray? Like, I was so paranoid because I had just had sinus surgery 4 days before that. And it smelled instantly, and I knew it. And it's just one of those things where you go, I'm not going back there. I'm not taking the risk. I'm not even going to go in there to pay and go to the bathroom. I made my husband go in there and pay for everything. And I said, let's stop someplace else so I can go to the bathroom, because I'm not doing it. And you do become very, very sensitive. But I think the biggest thing is to trust your instinct.
Amen. Yes.
Many times people will say, like, I knew there was something, but I didn't know what, and I couldn't do this, or I wish I would have done that. And you really just need to trust your instinct on these things.
I would agree. And, I ask a lot of questions. I work, and I'm not running my consulting business right now because I'm very excited about the work I'm doing with Respirari, truly. But in my consulting work, and I help people just take a step forward. So I ask a lot of questions, but I'll ask, does your house smell musty? And oftentimes people will say, well, sometimes. And the reason is that when we smell a musty odor, what we're smelling is called a microbial volatile organic compound, or an MVOC. So these are primary metabolites of mold, where mycotoxins are secondary metabolites. So primary metabolites, for those who don't know, are metabolites rendered by a life-sustaining process, where secondary metabolites are, it's like the mold switchblades, it's defense mechanism, and mycotoxins are not alive. But MVOCs are commonly known as mold farts. But what's the reason that we don't always smell them is that VOCs will off gas more readily in environments of high heat and humidity. So people will say, well, our basement smelled musty, but I started the dehumidifier and now we don't smell it. And I want to be really clear. You're mitigating the odor, you're not removing the issue. And so, and our basement was the same. It would smell musty or earthy in the summer, but not
Mhm.
in the winter when it was really dry. So it's important to understand that. And if you smell a musty odor, there's usually a source somewhere. And by the way, I believe you're in Wisconsin, I'm in Minnesota,
Yeah.
and basements are they're such an
Yes.
issue. But people will say, well, we have a really icky basement, but we don't go down there. And
Yes.
I'm sorry to say, but the basement is a very important aspect of your indoor air quality, and that's because
Mhm.
air moves. It's called the stack effect. Air moves from areas of high pressure to low pressure. So besides air moving through pressure differentials, you also have your HVAC system. So great that you don't go down there, but that air does. So if you have a crawl space that's not encapsulated, if you have a icky, scary basement, you're not going to have a healthy home. So I don't care how well you seal it up. It's really important to make sure that the biology in your basement is very good. So
I think another myth that I'd love for us to talk about is new homes, right?
ah,
So I will
it's
hear people say, and I did it too. I have a new home. There's no way my new house can have mold. And I remember getting ready to go for my sinus surgery, and my ENT said, "You got to test your new home." And I'm like, "My new home is like 4 years old. It was built in 3 months. It doesn't have any problems to it." And sure enough, my kitchen tested positive for mold. And I was like, what in the hell? This is a brand
yeah,
new house.
yeah.
And we had a building biologist come out, and she did all the testing everywhere, found a couple little spots on some floor joists in the basement, nothing that was major. But we were like, where is this coming from in the kitchen? It made absolutely no sense to us. It ended up being our countertop. We didn't do granite countertops. We had the
Um,
typical laminate type countertop, and it was in the press board underneath. When we got underneath there, we could see a white film on that press board, and we swabbed it out, and sure enough, it was moldy in there. And
uh,
we had it taken out. And I always, like you were talking about smells, I would come into the house and I would be like, what is that smell? And I couldn't put my finger on it. It wasn't a musty smell. It wasn't a nasty smell. And my husband would say, I don't know what you're smelling. And he has no sniffer. I have a
my
sniffer like
husband
yours.
says the same thing.
And so I said to him, I said, here's the thing. We know this has mold and I'm going to have this surgery. Why don't we just take the countertops out and see if the smell goes away? And he's like, are you kidding me, Deb? Do you know how big of a feat that is? I mean, I have this huge island, I have a huge kitchen. And I'm like, just put them in the garage. If it doesn't change the smell, we'll bring them back in. We put them in the garage, and literally within 24 hours, the smell that I always smelt in a particular spot in the kitchen was gone in 24 hours. And we left it out there for a couple of weeks, and the smell never came back. We had our building biologist come back. She retested stuff. There was no mold in the kitchen anymore. So we replaced the countertops, never had the problem. But who on earth would ever think you would have mold in your countertops? I would have never thought that.
I mean, besides your story, that's the first I've heard that. But
Yeah.
answering a phone at a remediation business for 3 years, I heard a lot.
Oh, yeah.
And I would typically get calls from people that would say, well, I have these weird health issues. I'm seeing this doctor. They think I'm being exposed to mold. And and then I'd ask about their house. Well, it's not my house. It's a brand new house.
Yep.
And I won't say who, but there's a builder, a very big builder and I got calls from people in their homes frequently. One of them was a young woman, and she lived in my area, and I was talking to her, and I said, "Gosh, it sounds like you have mold illness."
Mhm.
And she goes, "Well, I can't. My house is 9 months old." And I said, and so she ended up doing an inspection, and there was mold throughout the house. I mean,
Yeah.
Deb, throughout the house, and it was very hidden.
Wow.
So what folks need to know is that these houses go up so quickly, and a lot of lumber comes from the lumber yard moldy, then it's
Yep.
encapsulated, then it's sitting out in the elements. We
Yep.
we're in a small town in the west of the suburbs in Minnesota, and it's just blowing up. And my kids are so funny. They just finished the second and third grade. And last year we had a neighborhood like just pop up right next to us.
Mhm.
And my kids are so funny. Mom, you should stop by and give those families your card, because did you see how fast those houses went up? Mom, it's raining. Do you see all that lumber there?
Oh
So
my God.
you have bad building practices, you have
Yep.
subcontractors. I mean, I roofed houses when I was in college, and I didn't, I was great at shingling, and I
Mhm.
was strong as heck, but I didn't have any, building knowledge. And so you can't trust a new home. And
Yep.
oftentimes I'm telling you, some of these ticky tacky houses. So for anybody that's in a new home, this is what I tell them is be very acutely aware of when your warranty is up, and
Mhm.
then get a very, 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 very thorough inspection
Yeah.
prior to that warranty coming up, because if there is an issue, then you can, nip
Mhm.
it in the bud. But I'd be terrified to build a house, and eventually we will, but I'm going to keep it small and simple
Yes.
because I see what can happen. But the age of the house really doesn't matter. It's not a factor in my opinion and experience. And sometimes those older houses, they breathe better. Sometimes they
That's
were
right.
just built better. So unfortunately, I wish it was that easy, because
I
we were
wish so
just
too. Yeah. Well, and we forget a lot of these building materials that are, it's not just traditional lumber. They come from other countries. They sit on a boat for months at a time. They're sealed up. If they're using some things that have been sprayed with chemicals now, you don't just have mold, you have the chemicals. And
yeah,
we forget that people that are mold sensitive are EMF sensitive, they're VOC sensitive, they're
yeah,
chemically sensitive. So all those new home smells, quote unquote, are VOCs. That
yep,
causes problems. We're all on Wi-Fi these days. Nobody wants anything
yes.
hardwired, which makes the mold illness even worse. There's so many things that can make your illness and your symptoms 10 times worse than what they could be, but we just have to educate ourselves.
Well, and thank you for mentioning that, because just like we should look at the health of our bodies holistically, right? Because health isn't just an absence of disease, right? It's so much
Mhm.
more than that. But the same with the home. You don't want to get so hyper focused on mold, because it's like carpet. Carpet is one of the most toxic things you can put in your home.
Yeah.
VOCs are. I react to VOCs much like I do with mold, but also these VOCs. Will work synergistically with molds and gram-negative bacteria and endotoxins, can kind of create their own toxic compound. And so when you are buying furniture, mattresses especially, you want to make sure they're Green Guard Gold certified. So if you like, say you're shopping on target.com, you can go under the product details, and something that is Green Guard Gold certified will be rigorously tested for VOCs. And if you haven't heard of that, Deb, I'll send it to you, because it's very important. Oh my gosh, laundry detergent. Laundry detergent
Yes.
is one of and scented items. I know that you're going to have listeners that are going to yell at me for this, but diffusing essential oils.
Hmm.
It puts particulate matter in the air. VOC is, yes, I'm a fan of essential oils, and I use essential
I
oils,
am
but I
too.
never diffuse them. So there's so many ways to compromise your air quality. So it's important when you're considering your resources, that you look at your home holistically, and also your health, and don't get so hyper focused. Because I've seen people. I talked to a woman once, and she was giving me gruff. I can't believe you stayed in your house. You're never going to get well. And I said, well, I'm doing pretty good, and she was so hyper focused on mold, and she would just leave everything behind. And I'm talking to her, and she's drinking a Mountain Dew and eating fast food, and I'm just like, oh God, like.
Yeah.
So it's important not to get hyper focused, because it is not just mold, especially when we're talking about environmental factors. There's so much more to it. So
I think that's a great thing for us to touch on too, is what do we get rid of and what do we not, right?
oh,
Back in the
that's a great
day,
topic.
Dr. Schumacher would say everything has to go. You have to live in a tent. You can't do anything else. You can't serve, nothing can stay, nothing can come back in. And I think we've changed our thought process from that a little bit. And for a variety of reasons, we have much better testing, much better treatment of stuff, more knowledge of things these days. So, what are some of the recommendations that you make for people about their things? Because we love our things.
Yeah, no, thank you for bringing this topic up because it's really important. The topic of contents is it's a personal one and it's also a contentious one. And so we've remediated our home probably 7 different times. Now, for anybody that's like, oh my gosh, first of all, we did everything wrong the first way, which is why I'm here. I'm trying to teach people not to make the mistakes I made. I also want to tell people that I made improvement in my health with every remediation effort. We did not get all the mold in one swoop. And
Yeah.
and a step forward is just a step forward. So if you're feeling overwhelmed and you know you're staying in your house, a small step forward is a step forward. But the first time and second time we remediated, I got rid of everything and it was devastating. And by the way, I think it's dangerous to tell people because I was right when I was diving into this, people like, you have to replace everything, couches, everything, 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 plus fix your home. And otherwise you're not going to get better. It's all or nothing. And by the way, that's when I started to feel hopeless and made the plan to,
Yeah.
do what I was going to do. So that's dangerous. The
Mhm.
path forward is not the same for everybody. So pertaining to contents, this is how I talk folks through this. Number one, is it sentimental? Is it valuable to you in your heart, or does it hold value? Because the first thing that you should do, I'm somebody that I need to be taking steps forward all the time, all the time. And so if
Yeah.
you're waiting for remediation or a second mortgage to go through, purge your items. The less things that you have to deal with, that's going to save you time and money. So it's a great remediation is a great time to say, does this serve me? Do I need it? Because we live in a time of we just need so much stuff.
Mhm.
Um, Non-porous surfaces can be cleaned. Okay. There's mycotoxins don't get absorbed into things. I have a piano that is my whole life, my whole heart. I'm not getting rid of it. So, and by the way, there are surface tests. If you do have a valuable piece of, maybe it's grandma's piano or something that you really love that's valuable, we do have a surface test through Respirari, and you can order these tests by yourself, by the way, which is incredible. But, and then I would say, clean it. Try cleaning it if you can. Now, this is going to be really different for everybody because I have friends that are way more sensitive than I am. And so when we were doing things, I put everything in bins and put them in the garage that I just didn't have time to deal with. And then once I started emptying my toxic bucket and kind of getting back to my baseline, what I would do is I would set up outside and I'd open each bin and I think, you know what? I forgot I had this. I'm just going to get rid
Yeah.
of this. And then I would pay attention. Oh, I'm reacting to that. I'm going to try to clean this.
Mhm.
I'm still reacting. Now I'm going to get rid of it. So there is no one size fits all. And honestly, we've been through 7 remediations. We've got 3 kids. We're buried. We're upside down in bills. If we were to get rid of everything each time, I don't know where we would be. So, and
Yeah.
that goes back again to you have to be I always speak out of both sides of my mouth here. You have to be cognizant that there's these tiny terrorists and they're very real,
Mhm.
but you also have to be realistic.
Yeah.
And so I can you imagine? Like, well, we had a water event. Everybody get rid of all your toys, kids. We gotta
Yeah.
and so
Mhm.
after the third and fourth and fifth remediation, I was like, meh. I'm a big fan of microfibers. I go to Costco, I go into their automotive, and I have big stacks of them. And I always have a bucket of mild soap, whatever you want, water, and microfibers. And I always clean like that. So
Yeah.
don't, the path forward is going to look very different for different folks. Some folks have a wonderful husband like I do. Some people have a lot of money. Some people don't. Some people have family. And so you have to look at your situation, look at your resources, and make a path forward.
Yeah,
So,
that's great. That is great. I love that. And I too, I made the mistake and been that provider that said, if you don't get rid of everything, you're not going to get better, because that's what we thought 15 years ago, you know? And now I say the same thing that you do, let's look through it. We know things can be cleaned. Some things might not be able to be, but just like you said, bin it up, try it later when you're better. Certain things that you don't look at, you don't use, that have been in the basement for 7 years. Okay, you probably don't really need those things. You haven't unboxed them in 7 years. Why would you unbox them now? Now we take a very different approach today than we did 15 years ago. And we do see people, they get better. They don't have to get rid of all of their things. We have different treatment modalities now. You can fog your house with a dry vapor fog now, that we didn't have before, which can help a ton. But there's so many different things available. It's incredible how that's changed for sure.
if there's one thing that we didn't do, and it wasn't because I didn't want to, it's because
Mhm.
we just didn't have any money. We replaced all the kids' beds. I wasn't
Mhm.
monkeying with that, but
Yeah,
we did not replace ours. And it wasn't because I didn't think it was important. We just didn't have the
yeah.
money. So we vacuumed the heck out of it. And after our last, this was just recently, my
Mhm.
towel is in my shoulders. Just terrible, terrible. And
Mhm.
seasonal allergies, it just histamine dump, but my shoulders were killing me. And I said to my husband, I said, I think we need to replace the bed. And he goes, well, what if it's not part of it? And I said, well, we need a new bed anyways, I said, and beds get so icky.
Yeah.
And so we got a different bed. I'm sad to say that we, at the time, because this was recently right after our our second mortgage and huge remediation, we didn't buy one that was low VOC. But that's another thing. Like if you're going to replace these things, you want it to be quality. But I'll tell you, after we bought that new bed, I noticed a huge difference. And I'm just like, oh my God, I've been sleeping in a contaminated bed. So
Yeah.
if you're on the fence about anything, your bed, oh man, like
Huge.
that would be a good one to replace.
Yes.
So, and I know it's expensive, but
Yeah.
even me not being able to buy one that was Green Guard Gold certified, I already feel better. So that's,
We did the same thing when we tested our new house. We had a brand new mattress, and my ENT said, "You got to test your mattress." And I'm like, "Oh, come on, really? I just bought this thing." And I made the mistake when we bought the bed. I should have taken it back within the time that I had, because it was a little too firm and I was uncomfortable with it. So I got a nice little foamy mattress topper to stick on top of the mattress, never thinking that that was going to create moisture and take all of that in and make the mattress have mold in it. I didn't realize that. And so we took the mattress topper off, tested the bed. The bed was full of mold. It was awful. And we had just spent, I don't know, $3,000 to $4,000 on a brand new mattress.
well,
And then we got to talking with the guy who was coming to swap our mattress out, and he's like, "You might not have to get rid of that mattress." And I'm like, "Are you kidding me? It's full of mold." He's like, "I bet you it's your mattress foam topper, not the mattress." And he taught us about the foam topper and how you never put that on there. And so we took the mattress, did the same thing, took it out of the house for a while, let it air out, and waited about 2 months and retested it. And sure enough, the mold was not in the mattress, it was actually in the foam topper. And
oh, thank you for letting me know that, because we bought an RV and thank God it saved our life. And the mattresses in these RVs it's torture.
oh yeah, they're bad.
We got one of those foam mattresses, and I remember like
Yeah.
thinking of that because I'm like, I feel like I've read this and that's what's in this. So it'll be a good excuse. I'll say to my husband, we have to get a new mattress. We've
Yes, yes. The other thing he had said is, if you're going to do them, put them inside of an allergy cover, because then it keeps the moisture off of your mattress from your bed.
okay.
So when you're sweating, it's keeping it off the mattress, and then it won't get the mattress moist, and then you won't be
Okay.
breathing. toxins. And so
Oh,
we were happy we were able to save the mattress, but I didn't sleep on it. We stuck it in a spare bedroom that nobody ever sleeps on anyway. So like, maybe one person every 2, 3 years comes and sleeps here. So we were like, oh, we'll just stick it in there. That'll be okay. And we ended up, we did the same thing, bought a new mattress just because I'm like, you know what? This is my brain. I can't be sleeping my head 8 hours a day or 6 hours a day against something that's moldy when it's my brain that's having problems. I'm like, I just can't do it. And
right,
I,
right.
I would really encourage patients, like when you're thinking about being sick, think about that. Like, is it worth you risking cancer? Is it worth you
Mm.
risking ALS or Parkinson's or MS or these types of
Yeah,
things by not treating and dealing with the mold? Because that is eventually what your fate is going to be if you don't deal with this. And I think that's the scariest part for people. You're not just going to get mast cell, you're not just going to be sick. You will develop one of these diseases when it
yeah,
takes out your immune
that
system.
and end stage mold illness. And thank you
Oh,
for
mhm.
knowing that and for bringing that up.
Yeah.
I just went to San Diego for the International Functional Medicine Conference, and I got to meet these folks at Healing ALS. Amazing folks, and their mission is to, to show people all of these different factors and that this can be dealt with, and they're very set on looking at mold. And I knew this, I knew ALS was, could be connected to mold because I'm an advocate in my personal life too. I have a group called Minnesota Mold Illness. Right now it's just a Facebook group, but I have people in my community who have lost spouses to ALS at a young age, and then they started getting sick and realized they're in mold. But I mean, long-term mold exposure, like the previous homeowner of my house, I don't know if she was hypersensitive. She was here for 20 years, but she died very young of cancer. And so, people say, "Gosh, Andrea, I'm so sorry that you have this hypersensitivity." I'm not. I'm a woman of faith. I believe it's a gift from God because I would do anything to keep my family safe. And for me, it's like a sixth sense. And it's like, "Ooh, something's wrong in here." And because of that, my family will always be in safe environments because, and I want to make this really clear because some people just are not grasping this. Just because I'm hypersensitive and you're not doesn't mean that this isn't affecting you. And yes, maybe you're not feeling symptoms or maybe you're not connecting them and your bucket isn't full yet. But I want to make really clear these mycotoxins are carcinogens, neurotoxins, hepatotoxins, all of the above, and
Mhm.
they will lead to cancer, to dementia, Alzheimer's, and it's just not worth it. I always tell people, like, if I'm going to fill my toxic bucket, it's going to be with like pizza.
Yes, exactly. Little
Something a little,
wine, a little
yeah,
pizza.
maybe a little tequila, something
Yeah.
fun. But and also for the people that I very ironically a mycology enthusiast, and if you could see my home a little better, you'd see I have mushroom figurines everywhere, which is ironic. But people really like to simplify mold. Well,
Mhm.
Andrea, mold's everywhere. Absolutely. Mold we use mycotoxins and antibiotics
Yep.
and mold and fungi play very, very important roles in our world.
Mhm.
However, yes, mold is ubiquitous. You will always have mold spores in the air. That's just fine. That's a normal fungal healthy ecology. However, you should never, ever, ever, ever have active mold growth and water damage anywhere within your building envelope. And I don't care where it is. I don't care if it's in your attic. I don't care if it's way behind your wall or behind your siding. Yes, mold is ubiquitous. We've got that. But it's usually these husbands are like, mold's everywhere. My wife is nuts. It's like,
Yes.
yes, but you should not have active mold growth within your building envelope.
Yep.
Period.
Period. And
So,
that means your work environment too.
yeah,
Like
and school.
at schools. Oh my God, we can
Yes.
have a whole conversation about schools. Every school
Um,
building is toxic. It just is. I mean, let's think about it. They've all been built over 50 years ago, the majority of them. They don't have a lot of money to build them properly. They don't have the money to maintain them properly. Things happen
mhm.
all the time. I cannot tell you how many teachers I see that are sick with mycotoxin illness.
I see that a lot too.
Oh my gosh, it's terrible. It's terrible. And the kids, we wonder why they can't learn. We wonder why they can't think, why they can't sit still. Well,
Yeah.
hello, they're in a toxic environment for 8 hours a day, breathing this toxins and the toxic chemical solutions that they use to clean with,
Yes.
the
And
toxic food we
yep.
feed. I mean, we could go on for hours.
No, and it's an important, it's a topic that's close to my heart. And I was actually just on a panel with a gentleman called Patrick Lee. He's got an organization called Clean Air for Kids. His kiddo would go to school fine, and then he would have to come home in a wheelchair some days. And he went to the school board, and they did their
Yeah.
testing. Said, well, elevated Aspen. My boss at Respirari Labs sent him our mycotoxin air test. I love this. And he wore the sampler and then put the pump in his backpack, and they took a sample incognito, and it came back with mycotoxins. So they pulled the kiddo out of the school, put him in a new school, tested that school. The kid's wonderful now. He's not sick anymore. But they were just on the news. This is a really interesting story. And the school district I think it's in Illinois, I think, somewhere in the Midwest. But there's all these kids at this school that are sick. And the school's not doing anything. And
Yeah.
and they're not taking this mycotoxin testing seriously because they're like, well, there's no regulations. Wait, what's a mycotoxin? And it's just like,
Yeah.
oh.
Yeah.
But and we did the same thing we live in a small town. We love our teachers, we love our principal, but we had them test a school, and they were so gracious about it. But um my kids are reacting to something. And my little girl, she's just a canary. Mom, I was dizzy today. I had a headache, and we don't know if it's the chemicals, because it's my husband too. My husband, that was I'm fine. Go, the door's there. Now he's like, something's amiss in the school. I'm like, oh, tell me about it. But but who knows, because we're so sensitive now. And
Yeah.
my husband jokes with me, he goes, first of all, you have to stop reading because we're not going to be able to eat anything anymore. You've taken the joy out of our lives. And he says so very lovingly and jokingly, but he blames me for us being so sensitive. He goes, you require such good air quality in our homes that it's hard to travel and go anywhere else. So we do a lot of camping.
Yeah. Well, I think there's some truth to that. The cleaner our bodies get, we are more sensitive. We start to notice more things. And I will tell patients that all the time. When you start dumping the chemical load and your bucket's getting lower and lower, you will notice when you go someplace that you don't feel bad, because when you feel bad all the time, you don't pay attention to it. It's your normal. So
Yes.
now that you're starting to feel better and you don't have these exposures, you're going to notice things and pay attention to them. It's important.
And I would agree with that, because this issue in my bedroom, that was our last remediation.
Mhm.
It was always there. And I
Yeah.
really struggle with that because I've made progress with every remediation. And I'm like, how did I not know? But it did, it snuck up on me. And
Yeah.
again, my health started to decline. And so my husband said to me, we finished, I mean, it was a really expensive remediation. And oh my, and that year we had to buy a new truck. Our furnace went out. I'm just like, okay, Lord, that was three.
Yeah.
Send a winning lottery ticket. But he
Yeah.
said to me, he goes, well, do you think we got it all? And I'm like, probably not. There's
Yeah.
probably more. But and for people that think I'm nuts, my house it feels better than most houses.
Yeah.
It really does.
Mhm.
Um, but you're not going to heal your home overnight. And
Mm.
that's okay. And so if you're feeling hopeless, I want you to know that there is hope. Mold, one thing I want to say before we end things, because it's close to my heart, and I know this because I talk to a lot of people, and I think it's important to open this dialogue. Mold can cause suicide ideation, and for
Yes.
me, that's what it does. And
Mhm.
I'm very aware of it, and it's interesting.
Mhm.
And I have some wild theories behind it, but it can cause thoughts of hopelessness,
Yeah.
and there is hope to be had. So if you are feeling that way, please reach out. You can reach out to me, but there is hope to be had. These things they're not hopeless,
No.
and no matter where you're at with your resources, a step forward is a step forward, and there's so many ways that you can take a step forward. We are not wealthy people. We've never been wealthy people, not even when we started this journey, before we spent all this money on remediation. And I feel very good today. So please don't lose hope. And it's knowing that mold can do this, you're 3 steps ahead of the game. Truly. So
Absolutely. Andrea, tell us a little bit before we leave our conversation today. Tell us a little bit about Respirari Labs, what you guys do there, and how it can help some of the people that we're talking to today.
You got it. First, I want to say that if I won the lottery today, I would still be with Respirari Labs, and I want to make that very clear. I'm not making big bucks in this job. So Respirari Labs, first of all, the technology came out of Australia. There was a couple researchers back in 2016 and 17 that said these people are nuts. There's not mycotoxins in our air; it's in our food. So they created this air test to prove people like me wrong, and then they were like, "Oh shoot." So that's where the technology came from. My boss a wonderful man, happy to say that. He was a remediator in Portland, Oregon for many years, and he would see families. He would do everything right. He'd pass all the tests, but he would see families remain sick. And it's because, again, they weren't addressing mycotoxins and remediation. So in 2022, he sold his business. He tried to retire, and then this laboratory in Australia approached him with this technology. So he came out of retirement. It's fairly new in the US. It's been around about 3 years. I've been working with it in the field in my last job, so I have more experience with it, not just in my own home, but in the field, and it's wonderfully sensitive. And it was the only test, like I'd go along with inspections and I'd say, "I feel pretty good in here," and the air test would come back clean. And then I'd go another environment, so I'd be like, "I feel a little off in here," and it would come back actionable. But what's great about it is we have a do-it-yourself option. So no matter if you're got a lot of people in northern Minnesota that don't have access to good inspectors, maybe they just need a data point to start the process, right?
Mhm.
Because I want to be clear again, environmental sampling is just a data point. So if you
Yeah.
ever do get a test that is actionable, it's a piece to the puzzle. You need to have a
Mhm.
diagnosis. But anybody can go online and order these air tests or surface tests at Respirari Labs. Respirare is Italian for to breathe, but it looks like respir rare. But I'm happy to be with the company. I think that it's going to change the industry. I think it's going to change the mold paradigm because the sample collection meets international
Mhm.
standards, which I won't bore you guys to death, but that could mean big change for legislation policy reform. But I'm really excited by it. And again, I want to reiterate that there's a number of environmental tests on the market, and there is a time and a place for every single one. And yes, I work for Respirari Labs. I think it's great technology, but I might not recommend those tests to you depending on what your objective is. And again, that's really important. So figure out what you want to do with that data point and then pick a test. So,
Yeah, that's
but yeah.
awesome.
Yeah.
Well, thank you so much for your time today. This was a great conversation. You are so informative on this, and your story is just so wonderful. I mean, you've been through a lot, but you've come out of it in a very positive way. And I appreciate your honesty and vulnerability in sharing some very, very sensitive issues. And I know our listeners can relate to a lot of the points that you've talked about. And I think it'll make them feel comfortable they're not alone and just that they have resources out there and not give up. It's really wonderful. Thank you.
Well, and thank you for creating a platform for me to tell my story and for continuing to spread awareness. I'm very grateful for the work you're doing. So,
Well, thank you so much.
Thank you for listening to the podcast. Let's Talk Wellness Now brings expert insights directly to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult with a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcasts. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised.